Hey friends, happy Saturday. Secrets of the ME patient. Um, I know I can never do just one. I'm giving another gift because my birthday is in a couple of weeks. My birthday, so think of this as my birthday present to you, whenever your birthday is this year. I'm just getting a nice coffee together. Now, a lot of you that follow our posts, on the social media, and you're advocating for awareness. And that's great. All right. Just we warn you, our group warned you. Be careful who you're donating your money to. Be careful who you're listening to. All right. Because they're out there, okay, making a profit what they're doing. Okay. They don't necessarily care about you. And I hate to say it that way. And I know it hurts hearing that. But it does. But it's true. All right. What I notice, the term some of you are using, and I'm going to tell you the reason why it's not a good idea. You're using the term neuroimmune. That ME is a neuroimmune disease. And I know Dr. So-and-so said it, and I know which Dr. So-and-so says it. And actually, one of their backgrounds, that Dr. So-and-so is psychology. All right? But please, don't use the word neuroimmune. Okay? And I'll tell you why. Autism has hit close to my home. All right, years ago when I was young and my kids, I was very ill. I couldn't even get to meetings at the school for accommodations. I'd be over the speakerphone, and you think I remembered anything? We eventually got an advocate, okay, to do that, because you really need to know the laws that go with IEPs and 504 plans and all of this to get really anything done by the schools. All right, and if you looked up articles then, even up to as late as 2005 and 2008, what you'll see autism referred to as the neuroimmune behavioral disorder. Neuroimmune meant psychiatric. So please don't use the word neuroimmune, okay, because you're taking your credibility away with a lot of providers out there, okay, and scientists too. They think of neuroimmune as psychiatric. And I can guarantee if you're telling a doctor or a provider neuroimmune, there's going to be at least one prescription, and that stack of drugs, prescriptions that you're getting, that's a psychiatric drug. CFS has made, it sells psychiatric drugs. All right, it has made companies billions of dollars on drugs like Prozac and Xanax, etc., since 1988. All right, so neuroimmune. And I'm not going to give you a link for any of the things, all right, because I do have 25 years at least of bookmarks, okay? And when I throw something out there, you have to look at it as a gift. I'm not going to do any lookups because it takes a lot of my time, and time is money. All right, really, I'm going to be honest with you. Anybody who wants me to throw out links, they got to pay me. All right, because all I get is aggravation, actually. I get aggravation. I'm not going to do it. But I will tell you this. Like I said before, autism, the neuroimmune behavioral disorder. You tell them ME is neuroimmune, I can guarantee there's going to be at least one psychiatric drug in that stack of prescriptions you're getting. It's neurological. Yes, there's a lot of immune things going on. Just don't call it neuroimmune. All right, because if you noticed, there's providers, scientists, etc. They are narrow-minded. They don't think out of the box. So they hear one symptom. All right, and I'll give you an example. Post-exertional malaise. That's a terrible name. All right, because the malaise, that's all they see is the malaise. I have seen doctors laughing about that in medical groups. They laugh because of the word malaise. Malaise isn't the symptom. It's not your crash. Okay, if you get an old medical dictionary, nursing, even dental, all right, and you see what they're referring to, and you look up the meaning of malaise, and I've did a few blogs on this, but of course, it takes years to get, for any attention. You look at the word malaise, you'll see what it really means. And it is not your crash, my friends. It is not your crash. So you have to be careful which terminology you use because they're narrow-minded. They don't think out of the box. All right. And neuroimmune is another word I have a beef with. It's just as bad as malaise. Have a good day.